Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio, and glad that you could join us. I'm going to have a conversation this morning with Dr. Jeffrey Hoffmeister. He's medical director at iCAD. And iCAD is a global leader in medical technology, providing innovative cancer detection and therapy solutions. And we're going to talk today about the role that 3D mammography has on radiologist burnout and medical burnout in general. You know, burnout in the medical field isn't an uncommon thing. But in radiology, it seems that burnout has grown substantially. Welcome to the program, Dr. Hoffmeister. Thank you for taking the time.
Sure. Thanks, Neil, for having me.
Give us a bit of your background, Doctor.
Sure. As you mentioned, I'm iCAD's Vice President and Medical Director. I've been participating in developing mammographic artificial intelligence, or AI, solutions for 25 years. My main role has been to manage the design and implementation of clinical studies for FDA approval of mammographic AI products, from iCAD's first mammography CAD product, which we called Second Look, in 2002, to our most recent digital breast tomosynthesis AI solution, Profound AI, just in December of this year, December of 2018.
What's your experience with burnout in the medical field?
It's definitely increasing in radiology. We saw the Medscape report that recently came out, and it's shown that the rate has grown substantially. In the 2017 report, the radiology ranked just 20th out of 27 medical specialties reporting burnout. But in the 2018 report, it increased and is now the seventh highest. In 2018 report, 45% of radiologists reported feeling burned out. And so, and some of the reasons that happens is radiologists face some real specific industry factors and stressors of their own, such as the changes in medical imaging technology. I just consider the move from 2D mammography to digital breast tomosynthesis, or DBT, which is also known as 3D mammography. In the last 2 years, the number of DBT exams in use at certified mammography facilities in the U.S. has grown rapidly, according to the U.S. Food and Drug Administration. From June 2016 to December 2017, about a year and a half, the same time frame as the Medscape reports, the number of DBT machines in use grew from approximately 3,300 machines in 2,400 facilities to 5,400 machines at 3,800 facilities.
Does this have to do with the rate at which radiologic imaging is taking place due to advances in technology, or is it the differences in technology that's causing the stress? When I think of radiology, I think of, people imaging. There's not a lot involved. Enlighten me. Yeah,
well, it's a couple of things happening at the same time. The increase in technology has brought more images and more things that radiologists can use to help diagnose patients, to help improve patient care. But with those images, sometimes, especially take the example of digital breast tomosynthesis, that comes with a lot more images, and so the workload is dramatically increased. Like, say, like the traditional 2D mammograms, there were just 4 images for each patient to analyze. But with DBT, the 3D mammograms, now there's hundreds of images for each exam. I mean, the DBT exam now help them find more cancers, because now you can kind of walk through slices of the breast and see lesions more clearly. But now it takes about twice as long to read, because now you have hundreds of images for each exam rather than just 4 images for each exam. And so with these extra images can cause reader fatigue, even sometimes difficulty concentrating as they're scrolling back and forth through the DBT exams. And so radiologists they risk missing important clues of early stage cancers when they're having such fatigue. And so that especially since breast cancer is one of the most commonly diagnosed cancers in American women, more than 330,000 new cases in 2018 alone, radiologists feel pressure to not be wrong, to not miss the signs of early breast cancer in their patients. At the same time, they know this technology is going to help them find more, but it takes a lot longer for them to do it, and so that can lead to burnout.
Does the fact that they can find more cancers often earlier contribute to some of the, elation in the industry as far as, cancer research and prevention is concerned? Does that alleviate some of the burnout, or is it just such a massive workload that physicians aren't able to keep up, especially with all the notes that I'm assuming go along with this imaging?
Yeah, that's a good question, Neil. definitely the excitement of, the clinical studies come out with DBT as that started coming online maybe 5 or so years ago, some of the first approvals in 2012. And so it gets easy to get excited that you're going to see cancer more. You go to a conference and you see as somebody's showing you scrolling through a stack of images rather than just have one picture of the breast you can see a cancer. But sometimes there's a tissue above or below that lesion that kind of obscures it. But now when you can kind of walk through slices of it, you get excited that, oh, wait, I'm going to be able to see much more. But now you get this technology into your practice and you see that rather than just the 4 pictures, I may have 50 or 100 for each of those. So I might have 100, 200 images to look at for each one. And you realize that rather than taking it almost takes you twice as long to get through each exam. And at the same time, there's not, especially in breast imaging, radiology in general, but breast imaging, there's less and less breast imagers. So now you have the same number of patients, but a lot more images to interpret with less people in your practice that are doing breast imaging. At the same time, that disease is so important to stay concentrating and stay focused, because you're looking for this needle in the haystack. Only maybe 5 per 1,000 women have cancer, so you're looking at negative exam after negative exam, in screening, but you have to stay vigilant. And now you got twice as many, you got hundreds, more images, and it's going to take you twice as long to do it. It's something that's very critical to do. It's easy to fatigue and burn out.
Well, tell us about iCAD's brand new AI-empowered detection solution. And how does this technology lend itself to reducing some of this industry-specific stress?
Thanks, Neil. Yes, iCAD, we just recently announced FDA clearance of our latest AI solution called Profound AI. It's a high-performing, deep learning-based cancer detection and workflow solution for digital breast tomosynthesis that delivers critical benefits to radiologists, their facilities, and their patients through improvement of cancer detection rates. Like DBT on its own already improves cancer detection rates, we even add to that improvement by an average of 8% in terms of finding 8% more cancers, while at the same time decreasing unnecessary patient recall rates by an average of 7%. The new technology is trained to detect malignant soft tissue lesions and calcifications, so all the main signs of breast cancer that we're looking for while we're screening. But it also provides radiologists important scoring information that represents the algorithm's confidence that a specific finding or case is malignant based on a very large data set of clinical images that was used to train the algorithm and to calibrate the scores.
Now, is this technology designed to instantly replace a facility's current imaging, or is it something that can be gradually integrated into a practice?
Good question. Yeah, the technology itself is additive to the current technology that they have. So when the facilities went from 2D imaging for breast imaging to 3D with the digital breast tomosynthesis, that's what we talked about. It took a lot longer to read, but actually they found more cancers. Now our software works with the digital breast tomosynthesis. It doesn't replace digital breast tomosynthesis. It reads with it. It's kind of it analyzes the DBT exams and points out the lesions that might be malignant. And so the radiologist can more quickly find locations that may be of concern. So it kind of changes their reading paradigm. It becomes a concurrent read where they can, rather than kind of exhaustively scrolling through all the slices, they can, at least at first, look at the places that Profound AI detected, check those spots out, and now they're deciding is this something that's interesting or not? Is it something that potentially is suspicious, potentially worrisome for the patient? And so then they can still scroll through all the slices, but they've gotten a good overview of all the most pertinent areas right off the bat. And so they can make it more of a directed search through the stack of images rather than kind of exhaustively searching. And so it basically, that's how it works. It ends up, so it doesn't replace anything they currently have. It adds to what they have, but it makes them be able to use the technology they have more efficiently.
Enhancing the current situation.
Yes, exactly, Neil.
Well, where can our listeners go online and learn some more about iCAD?
iCAD's website is www.icadmed.com. There's a fair amount, definitely a lot of information there. You can learn about not only that product, but other products that we have. And it's really can revolutionize the reading of digital breast tomosynthesis exams, which are incredibly helpful in terms of finding more cancer, and ours can help radiologists do that even more efficiently.
Jeffrey, thank you so much for joining us here on the program. It's been a pleasure.
Likewise, Neil. I really enjoyed the time with you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Jeffrey Hoffmeister, Vice President and Medical Director at iCAD. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can subscribe to this podcast on iTunes, listen in and download it on SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.